What type of revision Asian eyelid surgery can make my eyelids symmetrical? I'm a 39-year-old female and had my eyelids done more than a year ago. Not happy with this asymmetric result. They used a non-incision method, and I was told it was easier to fix if I was not happy with the result. The doctor who did it now informs me it's hard to take the stitches out. Is it possible to achieve a more symmetric result and a more almond-shaped eyelid and make my eyes look bigger?
Thank you for your question. You're 39 years old, and you stated that you had Asian eyelid surgery of a non-incisional variety 1 year ago, and you're unhappy with the symmetry of your eyes, and you submitted a photo with your question. And you want to know what kind of surgery can be done to improve the symmetry, as well as how to achieve an almond shape to your eyes. Well, I can give you my opinion based on just this one photo. I'm a board-certified cosmetic surgeon, and I'm a fellowship-trained oculofacial plastic surgeon. This means my background training was first in eye surgery before I specialized in cosmetic reconstructive surgeries of the eyelids. I've been in practice for over 20 years in Manhattan and Long Island, and Asian eyelid surgery is one of my specialties. What I think there is, the issue could be with your asymmetry, has to do with more than one factor in terms of the eyelid crease. If you look at your previous photos, before you had the surgery, chances are there was an absence of a crease, or there may have been less definition, or there was asymmetry to begin with. So chances are your doctor tried to measure a certain amount of height from the eyelid margin to set the crease to create more symmetric creases. What there appears to be also is which is a reality for all of us, is an asymmetry in the orbit, or it's important to understand that the face is asymmetric. So when you look at your eye sockets, there is a clear difference in the volume of fat or soft tissue in the left eye compared to the right. So a lot of times, and this requires conversation and back and forth, but I would say that a lot of times when people are not happy with their Asian eyelid surgery, if they've had too much fat removed, well, we try to restore that by adding fat. In a case of non-incisional, that's not usually the case, where they've had fat removed. A lot of times also, with the absence of fat or the loss of fat, it is hard to achieve that symmetry without adding some kind of volume. In our practice, we've also had success not only in placing fat in this sub-brow space under the brow area, but we've also placed filler under the brow in a way to create a shape that adds more volume. And so instead of it being a subtractive procedure where you're taking away something, we're actually adding something to create more symmetry. I think the goal of achieving symmetry has to be tempered with the realities and the limitations of the anatomy and the risks and benefits of the procedures that you're entertaining. As far as almond shape to the eyes are concerned, that's usually more of a function of the outer corner relative to the inner corner. So if you feel that with time or changes, the outer corner needs to be a little bit higher, well, that falls under more of a lower eyelid procedure, or a canthal or canthoplasty or canthopexy procedure. So it's a different surgery, and there are other there are certain traditions in Asian eyelid surgery which do include extending the width of the eyelid by opening the outer corner and trying to create a widening and lengthening, I should say, of the eyelid, widening from the horizontal perspective. So that's a separate procedure, and it may be something that would be of value to you, but I think that you need to meet with either your original doctor to discuss this, and if you need additional opinions, seek out other doctors who have extensive experience with Asian eyelid surgery to try to narrow down exactly what you'd like to achieve to improve your results. Because I'm not so sure that releasing the non-incisional sutures will be necessarily of value, because in terms of the eyelid crease, a millimeter here and there is usually tolerated, but if you're overall unhappy or dissatisfied with the appearance, then there's probably room to entertain other options. So I hope that was helpful. I wish you the best of luck, and thank you for your question.